Hi, I'm Dr. Christopher Bunick, Associate Professor of Dermatology at Yale School of Medicine and Editor-in-Chief of Dermatology Times. I am here in Denver, Colorado at the American Academy of Dermatology annual meeting. And here at this meeting, there is a lot of late-breaking, wonderful new innovative science and clinical translation that is happening. One of the most important pieces of data coming out is around extended release minoxidil that is coming out by Veradermics. And joining me today is Dr. Reid Waldman. Reid, could you please introduce yourself and your company to our audience?
Chris, thank you for having me. I'm Reid Waldman. I'm co-founder and CEO of Veradermics. I'm a board-certified dermatologist by background, and prior to founding the company, I spent most of my time, like you, in clinical research. I've got 100 publications. I wrote a textbook. I was an investigator for many phase 2, phase 3 studies, and really, Veradermics was born out of clinical practice. And as you know, but many may not, Veradermics is an aesthetics and dermatology-focused pharmaceutical company, initially aiming to bring a new treatment to the 80 million people with pattern hair loss. And that, as you mentioned, is VDPHL01, a minoxidil extended release tablet. Now, the premise here is very straightforward. Minoxidil, as we all know, is validated biology for hair loss. Right? It is FDA approved as a topical for both males and females, but we all also prescribe it orally as a blood pressure medication and off-label for UCIs. Now, fundamentally, that 40-year-old oral drug is a blood pressure medication. And when you take it, what you see is exactly what you would see when you take blood pressure medication. It spikes quickly. Within 2 hours, the majority of it's gone. Within 4 hours, almost all of it's gone. So Veradermics, we ask the question, why is the best tool in our toolkit as dermatologists a 40-year-old blood pressure medication that no one's aimed to optimize? And we set out to optimize it through an extended release tablet that provides consistent and durable exposures throughout the day of minoxidil at levels above those at which we've grown hair while staying below those of which it's known to have cardiac effects. And that's what we're here to talk about today.
So I think that there's two parts that I want to follow up on that. Can we talk about the pharmacokinetics of the extended release minoxidil and why it matters for restoring hair growth and pattern of hair loss patients? And then we'll come back and talk about the clinical data that you're going to be sharing.
Absolutely. I think this is really the core of what you do is optimizing those pharmacokinetics to deliver a differentiated clinical profile. And in essence, what we mean by that is today when you take minoxidil, as you would expect for a blood pressure medication, it has those quick spikes that are meant to rapidly lower your blood pressure and then it crashes very quickly. That doesn't give the hair follicle that sustained exposure that it needs to grow hair. And so what we do is we provide consistent and durable exposures of minoxidil throughout the day. And so if you look at the pharmacokinetic data that we previously presented from our phase 1 studies, what you would see is that we were able to give greater exposures of minoxidil for a longer period of time while blunting those peak plasma concentrations that are responsible for the cardiac effects of minoxidil, ultimately with the goal to maximize hair growth and minimize the risk of cardiac side effects.
So, Reid, when you have your extended release minoxidil above that threshold needed to grow hair, well below the cardiac threshold to increase heart rate or have other cardiac adverse events, what is happening physiologically? Can you tell our audience about sulfation and what that means for hair growth?
Yeah, so you're getting into a key piece of nuance. Obviously, we give more minoxidil for a longer period of time, but really one of the often missed critical attributes of the extended release tablet is the ability to potentially drive the bioactivation of minoxidil to a sulfate metabolite. Now, many people don't realize this, but minoxidil has no effect on the hair follicle itself. It has to be sulfated to minoxidil sulfate, and that sulfation can occur in the outer ring sheath of the hair via the SULT1A1 sulfotransferase. Now, that enzyme, like many enzymes in our body, is capacity limited, meaning it saturates, and it's time dependent, meaning it takes time to take that minoxidil, turn it into minoxidil sulfate. Now, if you think about the pharmacokinetics of that existing blood pressure medication, it spikes quickly. That overruns capacity. It saturates that enzyme, and it gives a very limited duration of exposure, meaning it doesn't give sufficient time to sulfate. Whereas if you think about the ability to keep that minoxidil at the follicle at optimal levels for a longer period of time, then you have the potential to drive the sulfation drug, right? Drive the formation of the true active that drives hair growth. And we believe that that gives the potential to drive greater hair growth in a greater percentage of people.
So there you hear it. VDPHL, the extended release minoxidil from Veradermics, has the ability to allow minoxidil to be sulfated to its active form for a longer period of time, which should translate for our patients into increased hair growth.